Hi, I'm Kimberly Bain. I've always been interested in the best ways to stay healthy and fit. Lately, I've also been focusing on ways to use exercise to ramp up my energy and help my metabolism. Today, I'm meeting my endocrinologist at 180 Fitness in West Palm Beach to learn some ways to use exercise to achieve those goals. Come on, let's get started. Hey, Dr. Pepper.
Hey, Kim. Glad you could make it. I want to introduce you to Terrence Mayeno. He's the head trainer here at 180 Fitness.
Nice to meet you. You have a beautiful gym here.
Thank you, Kim. We opened up in October of 2008 last year, and we opened up with the philosophy of accommodating everybody, from your weekend warrior to your avid gym rat to your top-level athlete.
Kim, you were an exercise instructor in a past life, weren't you?
That's right. I used to be a personal trainer, and I just wanted to help people get in shape and stay fit.
Well, you know, as an endocrinologist, I treat a lot of people with diabetes, and it's essential for them to lose weight and ramp up their metabolism. And that's what I was hoping that you, Kim, and Terrence, you could help me figure out a way to do that.
Absolutely.
Great. Can you take us through some steps like we were clients?
Sure thing, Kim. I'd be glad to. Maybe we can even get Dr. P here involved.
Actually, I'm just going to take some notes here.
Come on, Dr. P. Put the pen down and let's get on the exercise floor.
Okay. You got me.
All right, Doctor. We're here at 180. We like to start off our sessions with a quick warm-up. We usually do about 2 to 5 minutes on a machine, and the most important thing that we do warm-ups for is to prevent injury. A lot of people will come into the gym and they'll skip the warm-up process and go right to a machine and get started, and a lot of times they'll end up pulling a muscle, straining a muscle, or getting injured, and then they're out of the gym for the next couple of weeks, so that's no good. So what we try to do here is get everybody to start off by a nice warm-up set. What we do is we'll put you on a bike, we'll put you on an elliptical machine or the treadmill and get you going. And what we like to do is set a level on there that is kind of challenging for you. You don't want to just jump on one of these machines and just go. You want to set a level where you're a little challenged and you're going to get your heart rate up and going.
Okay, well, you know, what I find is some of my patients will tell me that they start an exercise program and in a week or two they've injured themselves, and that's the end of that. So it sounds to me like your approach is going to help prevent that.
It's proven and effective, and that's the problem with a lot of new gym goers. They'll get in here and they're so focused on just doing the exercise part of it themselves that they'll often jump into it without having a proper warm-up, and they'll pull muscles or strain muscles and injure themselves.
Kim, you ready to race?
I am
Let's
ready.
go! Hey!
Pick it up, you two.
So we've been exercising here for a few minutes, and I think it might be a good time for us to take a break. I'd like to go over a few of the points about why it's so good for your health to exercise, and maybe if we stop now, we could move on to that.
Absolutely.
Good.
Sounds good?
Good.
Good. All right. One thing that's important to know is that abdominal fat is more than just ugly yellow tissue. It's actually producing metabolic toxins, and what that can lead to is a condition known as insulin resistance.
Insulin resistance is the basic cause of type 2 diabetes, right?
That's correct. So we have the fat cells causing insulin resistance, and insulin resistance results in high blood sugar, which is diabetes, but it also raises blood pressure, and it also causes high cholesterol. And when all those things happen together, that's known as the metabolic syndrome.
Fat cells affect hormone levels as well, too, correct?
That's correct, yeah. So fat cells not only cause insulin resistance, but they make hormone changes that lead to all sorts of problems, and people aren't really even aware of that. For example, we have our fat cells, and what they're doing in a woman, for example, is they're raising the testosterone level. And when a woman has too much testosterone, that leads to increased hair growth, that can cause irregular menstrual cycles and even infertility. And some experts think that the higher estrogen levels can also cause different kinds of cancer, like endometrial cancer. So it's really crucial that the fat be reduced, particularly the abdominal fat.
Now that we know the reasons why we should reduce body fat, can you show us your techniques to getting the job done?
Absolutely, be happy to. Well, based on what we talked about on the blackboard, Doctor, I think we got a great exercise in mind for our first exercise. It's called the V-up, bench V-up, and it will target the abdominal area and that abdominal fat we just talked about.
Okay, good.
So let's get started.
Sure.
If you're ready. I'm going to show you how to do it, and then why don't we bring Kim back in and let her demonstrate for us. Okay. Basically, we're going to get onto the bench. Our hands are going to be behind us on the bench, feet together in front of us, down to the floor, and we're going to basically pull our knees to our chest. Okay? And the movement starts up and then back out. Up and then back out. Okay? And what this is targeting is your lower abdominals.
Right.
Okay? And that's a big problem for a lot of people.
Sure.
A lot of our members come in, and the first thing they say to us when they come through the door is, hey, how do I get rid of my my midsection here?
Absolutely.
And
right.
so we really focus on that quite a bit here.
Okay.
Core strengthening is really the key to strengthening the rest of your body.
Okay, great.
All right, what we're going to do is, Kim, if I can have you go ahead and get flat on the floor here. Keep your knees bent, feet flat. Okay. The reason we want to keep our knees bent is it keeps some of the strain off of your lower back. Okay. Cool. Cross your arms there. And all we want to do on this movement is just roll our shoulders off the ground here. So if you could just roll, perfect, right there. And you're engaging your abs, tightening them up. Everything she feeling it right in here?
Yes, I am.
Perfect, perfect. And back down and up again. Good. Back down and up. And this will protect your lower back right here and still work your abs and engage your abs and work off that fat.
Great, thank you.
No problem.
Excellent.
So, Dr. P, now that we know why people should exercise and how to exercise, why don't more people do it?
That's a major problem. I think a lot of people have a mental block. They don't see themselves as exercise people, or when they did first try to exercise, they may have hurt themselves or had a bad experience. So that's where a gym like 180 comes in.
Absolutely.
You know, and it's even to think about the crazy schedules that people have and how much it costs. Those are major concerns for some.
Absolutely.
Well, here at 180 Fitness, we're here to help with all those needs. We design fitness programs around your schedule, your budget, and your individual fitness level. So we are striving to help out in any way we can and make it easier for people to get off the couch and get into the gym and get healthier.
Thank you.
What would I need to do if I wanted to sign up?
You can come and see us down here at 180 Fitness, or you can contact the number on your screen and make sure that you mention This Sweet Life when you do so. And we'll take care of you from then on out.
Great.
Great.
Well, thanks, Terrence. We
Not a
really
problem,
appreciate
Dr.
it.
P.
Thank you,
Pleasure.
Terrence.
Thank you,
Okay.
Kim.